Hi, my name's Dr. Gangmark Strickland, and my literature review is on the craniofacial effects of sickle cell anemia. Some background information. Sickle cell anemia is a genetic blood disorder. After the oxygen is removed from hemoglobin, it condenses as rods. This makes the blood cells stiff, which makes it hard for them to leave the smaller blood vessels. This can result in obstruction of the vessel, damage to the endothelial lining, and ultimately leads to tissue necrosis. Some symptoms are anemia, acute pain episodes, and some complications are septicemia, meningitis, pneumonia, severe upper respiratory tract infections, bone infarctions, kidney infections, organ failure, and a lot more. Some treatment options for sickle cell anemia, they're mostly prophylactic, so prophylactic antibiotics, and you can, if it's severe enough, you can be hospitalized to manage the symptoms, and analgesics. So there are some other drugs that increase the amount of fetal hemoglobin, and this decreases the propensity for insoluble rods, which just means that there's going to be less endothelial damage from the blocking of those vessels. And they're still looking for an agent that can block the adhesion molecules to prevent further damage. You can also get bone marrow transfusions and gene therapy, which is pretty new. The craniofacial effects most commonly seen from sickle cell anemia are class 2 malocclusion with maxillary protrusion and retrusion of the mandible, overjet, like a lot of overjet from the class 2 malocclusion, overbite, spacing in both arches, large trabecular bone, pulp necrosis, and incompetent lips. The dental implications, there's just higher incidence of caries, which is thought to be coincidental, and then higher rates of gingivitis and periodontitis. So the methods, I have some inclusion and exclusion criteria. The inclusion criteria is that it has to be in English. Sickle cell anemia, we're only looking at it in humans, and we're looking at studies that cover the craniofacial effects, so dental and skeletal. Exclusion criteria is unpublished, not peer-reviewed, studies without a bunch of evidence, studies performed on patients with other severe diseases or medical conditions, and then duplicates are removed. And I haven't gotten to the results and conclusion yet, so this is pretty much it. Here are my references.